Hi, my name is Professor Bravo, and today I'm going to do a demonstration on how to perform wound care on a surgical wound under sterile technique and a non-surgical wound. The skill will also include JP drain care and also irrigation of a wound. So first, I'm going to check my patient's chart. I want to review the order, make sure that it's correct for my patient. Then I'm going to go perform hand hygiene and get ready to go meet my patient. So I come in, perform hand hygiene. Hi, good morning, Mr. Smith. My name is Carmen. I'm going to be your nurse today. How are you doing?
Good morning, I'm doing good. Doing good.
Very good. Well, I'm gonna be the nurse changing your dressings today. Is that okay?
Yes.
Okay. Well, first of all, let me provide some privacy and check the room. Are you having any pain right now?
Yes.
Okay. Can you confirm your name and date of birth again for me?
Yes, it'll be John Smith, 01/01/1961.
Very good. Okay. So, do you have any pain right now from 0 to 10?
Yes, a 5 right now.
You have a 5? Okay. Can you tell me what's today's date? Do you know?
Believe it's March.
March.
Oh, March 8th.
Okay. And do you know who the president is right now?
Yes, Donald Trump.
Okay. Also, do you know why you're here?
Yes, I had surgery in my stomach.
Okay, very good. I'm going to go ahead and go gather the supplies for the dressing change. And since you have pain, did you say from 0 to 10 how bad is your pain?
Yes, like around a 5.
Like around a 5. Okay, so I'm gonna go see what medication do we have available to give that medication to you, and then we'll wait for the medication to work to go ahead and do the dressing changes. Is that okay?
Yes, thank you.
And I'll be right back, okay? I already medicated my patient. Now I have to wait some time for the medication to start working. In the meantime, I'm gonna gather my supplies, they're here, and my PPE. And a cool thing to remember about the PPE is that to put it on, you're gonna start from gown, your mask, your eyes, and your gloves. So I'm ready to go to perform wound care. At the moment I don't have my mask, but you will be wearing your mask as well. Okay. So now I'm coming back into the patient's room. Hi, Mr. Smith. I'm back. Privacy. And now I'm gonna prepare my field. Okay. I'm going to go ahead and raise your bed. How's your pain?
It's better. I don't really feel it at all.
Can you give me a number from 0 to 10?
Let's say 0.
Oh, that's very good.
Mm-hmm.
So I'm gonna put you a little high. And then I'm going to... Are you able to move a little bit to the side so that I can put this under pad here, just so that your bed doesn't get wet?
Yes.
Can you raise your arm for me?
Yes.
There you go. And then go ahead and put the pad. Okay, are you able to lift your hips for me?
Yes.
Okay. At the count of 3, 1, 2, 3. There we go. Very good. Okay. Just keep your arm. Are you able to keep your arm like this for me?
Yes.
Okay, that's great. Okay. So let me a little bit. So I'm gonna start off by emptying the JP drain, okay?
Sounds good.
Let me get my alcohol swab. Here. Let's see. JP drain is right here. So I'm going to first check. Okay, so I'm gonna remove the little cap here away from my face. and then the drain will fill up again. And I'll go ahead and do it to clean it up. Go ahead and collapse it, compress. And close. Okay. I will measure my output here, check the characteristics. We'll discard it in the bathroom and rinse it and use it for later. My gloves for this. The JP drain. I think again. And now I will come back to my patient again. So all my supplies. Here. Bring the rail down, Mr. Smith. Here, I want to start off by having my biohazard bag. Ready? I'm gonna go ahead and remove your dressing, Mr. Smith.
Sounds good.
Exposing your abdomen. Back a little bit. Okay, so I want to check the date, the initials, when it was last changed. I'm going to carefully remove the dressing, and then I'll go ahead and check the consistency, the color, the smell, and the amount as well. Discard it here, and then I'll go ahead and oh, can you hold me there? Then also, as I am preparing to cover the wound, I can take a look at the assessment and see if there is any bleeding, any redness, any odor, if there are staples or sutures in the site. So now I can go ahead and remove the other dressing, the other one. I'll go ahead and remove it. Same thing, I check for the amount, the consistency, the odor, and once I check that, and then I discard, and then now I take a look at the wound as well, and I check if there's any drainage, any bleeding, and if there's drainage, what's the amount, if there's a smell, also the skin color, the surrounding, and if there's any pain in there as well. So then I can also go ahead and remove my dressing, my gloves. And then I would apply a set of gloves. And I can go ahead and remove my gloves one more time. Perform hand hygiene. I'm prepping for my sterile fill. So check my normal saline, making sure if it was already opened, that is still within the 24 hours, otherwise I have to discard it. And I want to place that here. Check on all my supplies that are here and ready. So I have my supplies and I'm ready to start setting up my sterile field. And I have my trash can here. So remember that the table has to be above waist level. So that's how high as this goes, and the bed as well. But I don't. Okay. So I'm going to open my away. This side. Remember that I have 1 inch border. Oh, to place all my stuff. Okay, so this, if they're already folding over the table, I have to keep my margin. Goes from here there. This is no longer clean. Okay. Sterile, sorry. Okay, so I'm going to go ahead and start by putting my supplies in there. And I'm gonna go ahead and start with the gauzes. And I want to do this 6 to 8 inches. I have my sterile gloves, so I went ahead and left those there. But I'm going to, because I'm gonna use my own. So this is the hardest part here. Feeling confident here.
Honestly, you're being a pro. First try, she's dropping everything in the field.
Your lid could drop.
What happened?
Well, like you have to drop it like that.
Check off. You have to do it 1 inch. And
Like it has to be no further than 1 inch?
1 inch in the margin. So we're gonna speed this up, right?
So remember, you don't want to give once you have your sterile field, you don't want to turn your back to the field. You want to make sure that your patient is aware that you need to keep this area, away from any going over the field or touching anything. So I'm just gonna position my bed a little bit here. Just keep moving back. Okay. So I have my sterile gloves here. So what I'll do is and I'm gonna set up here I wanna loosen up my normal saline, the cap here, and then I'm going to go ahead and open my irrigation tray. Irrigation tray. Actually, I'm gonna put it here for now. And I'm ready to put on my gloves. Well, and then I'm going to carefully get my irrigation tray. To 8 inches. You're okay if you want to leave your normal setting here. I have the bedside table right there. You can also leave it there. I'll leave it here. And now I'm ready to go completely sterile. Okay, so do this. My field. And start setting everything. patient's arms here. I'm also not gonna use this one. Okay, Mr. Smith,
Hello.
are you able? I'm gonna put a pad underneath your on the side of your abdomen. Just
Okay.
don't move, okay?
Okay. Sounds good.
Right there. Okay. Do it with my glasses. So I'm ready to start removing the dressing. I'll start with the surgical dressing. Okay, I'm going to go ahead and remove the dressing, Mr. Smith. Okay. I'm gonna start cleaning the wound. One, two, three, four, five. And now I'm gonna go ahead and dry in the same way. One, two, three, four,
dry. This and go in position. Up. Now we're gonna do the same to dry it up. Am I dry? So top to bottom. Okay. See? Sponges. Okay, mister, I'm gonna go and come to the other one. All dressing, the old dressing. Okay. Come here. So don't move, Mr. Smith. I'm gonna go ahead and irrigate your wound, okay?
Okay.
I'm gonna go ahead and irrigate. Mister, the water's gonna feel a little cold, and you will continue irrigating until the drainage or the fluid comes out clear. Okay? Okay? So now I can go. Now my next step is to wick. Pick the one. And you can go a second time if there's a lot of if there's still a lot of saline, and we go second time. Okay. Now I'm ready to collect my culture samples. And then my do my aerobic first. Are you assuming? Usually the cultures have different colors, so be my aerobic goes first, and I'll go ahead and correct my aerobic. It's gonna be at the deepest. Okay. Now I'm ready to do my wet to dry. I do. Then I can clean any extra. Okay. Now I'm done with my sterile technique. I can go ahead and secure. You wanna name it and date it. Initials. Okay, bam. These are my cultures. Oh, sí, esto es labeling my wound. And I'm ready to pick up my field. Sharps go in the sharps container, and the rest in the trash can. Okay. Here. Make sure leave my patient. This will be in the sharps. Make sure I leave my patient comfortable. Label my normal saline. That's all. I will be in the biohazard container. Table, clean. Okay, if you leave do another 60-second assessment, and my patient doesn't need anything, then I can exit the room and go out and doff my PPE. I will start off by removing my gloves. If your hands became in contact with the outside of the gown, go ahead and perform hand hygiene right away. Wash your hands right away. But if it didn't, you can now proceed and remove your eye shield or your eyewear, your respirator, and your hairnet. Now you go perform hand hygiene, and you are ready to exit the room.